Hi, everyone. My name is Charm Penawart from Barm Talks, and we're here today to present Is Hormone Therapy Right for You? With our special guest, Dr. Pauling Tai. Dr. Tai joins us as the president of the Brazil American Academy of Aging and Regenerative Medicine, and as a chairman of BARM, and as the president of the Institute of Bones, Joints, Muscle, Pain, International Society of Obesity, Metabolic Dysfunction, American Academy of Anti-Aging, Clinical Nutrition, International Society of Stem Cell and Genetics. He's a speaker, an author of 14 health books, and a professor. So we're very excited to have him talk about this important topic of is hormone therapy right for you? We're going to analyze the risks that are involved and the benefits of bio-hormones and how to take it naturally. So please give us a warm welcome to Dr. Pauling Tai.
Thank you for having me.
Yes, we're very excited. We had a BARMS talk last quarter, and again, we're always trying to produce educational webinars for our doctors and our patients. So thank you for joining us. This is a very important topic. You get a lot of questions about, hormone replacement therapy, and I think that so many people are searching for the answers, but unfortunately, when you're scrolling through Instagram, looking through social media, even going to your doctor who's so busy, and you're just a number in a line of so many patients, it's really hard to get that care and the right information. So we're very happy to have you here because you've had 50 plus years experience in this topic. So tell us a little bit about what you're going to be talking about.
All of us need the essential molecules in our body to keep us alive, keep us healthy, keep us growing. All of the things that made you from a tiny little baby to all the way to grown up. Our head used to be this small, our hands used to be this tiny, and now our feet is this big and our head is this big. So how did we get to be the size that we are? How did all of this growth take place? How did we stay so healthy? How is it that allows for life itself to be healthy? And that is what biohormones do. They are molecules that are traveling all over our body, in our blood, and searching for how to orchestrate your body to be healthy. And so your hair, your growth, your tissue, your heart, everything has to do with your biohormones. So we are going to get into it, but these are biohormones are messengers. They tell the body what to do. And if you don't have someone, a manager, a vice president that actually tell your section of what you to do, then the body would not be orchestrated. It will not be working together with many different parts. It would be by itself doing its own thing and creating a mess. So we need the hormones in order for us to have a healthy life because it tells all the different tissues what to do.
So, as we age, I think we're losing these hormones, correct? Tell us about how we lose these hormones and what hormones are lost.
Well, when you're born, you really go through two different stages in your life. I know that many people don't think of it that way, but these are major stages. Charn, I will tell you, the first stage is when we went through puberty. All the changes in the world go through when we go through puberty. You remember those zips in your face, it changed your way. You started to become independent. You wanted to leave the home and live by yourself. You had girlfriends. You have all these changes in your life. But most people don't realize that we have another one that is just as big as the puberty, and that is called menopause. That's right. It actually pauses our life, and it is menopause and andropause for men, menopause for women. So what happens is that as we go through the later stages in our life, as we age, get to be closer to 50 years old, my goodness, the whole body changes. You will start to notice that you are starting to slow down. You notice that little by little, by 45 to 55, you will gain weight. You will start to have all sorts of wrinkles in your face. Your skin quality changes, everything changes. So, this is the way it goes. As we get older, we start to lose the biohormones. These are the changes. And most importantly, so that you know, okay, we have our best biohormones, the best level is when we are in our 20s and our 30s. Remember, 20s and 30s, you were doing terrific. I mean, you, my goodness, you were full of energy. You were the most beautiful girl in the school, and you could do anything. But as every 10 years, we lose approximately 15% of our biohormones. So by the time we get to be 50, 60s, we have lost 50, 60%. And yes, it throws you into menopause or andropause. So as we go down the age, we start to lose the essential biohormones that kept us healthy. And so we start to see the changes in our own body, we start to see the changes in our own brain, and we become much older.
Thank you for telling us about that. What is a biohormone receptor, though?
Yes. Well, many people don't know. I mean, actually, the truth is that we actually have many, many benefits for the biohormones, and so there are many benefits that actually help to protect our heart, to protect our brain, to protect our skin, as we talked about. But the hormones are sort of traveling in the blood, looking for where they can land, where they can do the best good. How can they help your body? And the way that we have to think about it is that the biohormones are looking for a receptor. This is a place where they can actually land. It's kind of like a key, and the biohormones are the key, and the receptor are the locks, so that you can actually unlock the door and start to work on keeping you healthy. The receptor is very important because there's a very particular receptor to every tissue. And that marriage between the biohormone and the receptor is critical because it needs to be exactly perfect. It needs to be 100%. It is fascinating how well the body works because it all works in harmony with each other. And so, looking for the actual supplement or the biohormone to actually help the receptor to do the job and telling the receptor what to do. This is a critical conversation, critical communication that keep in mind about the possible problems that occur if they are not perfectly in harmony.
What can interfere with this harmony, this
Well,
process?
so many different things that could possibly interfere with it. Obviously, if you had major stresses in your life, you got divorced, you got fired from your job. These are all the different kinds of changes that can occur in your body. But the most common one, unbelievable, is the biohormone actually made. Now, our body makes a very important biohormone that is identical to what we need, identical because it is made by our own body to work with our own tissues to keep us safe and to keep us healthy. However, when we start to use supplementation, why? Because as we get older and we lose the biohormones, as we explained earlier, because you are getting older, I tell you the truth is that the extra biohormone that we are actually using, the supplemental biohormone, are also 100% bioidentical. So it works beautifully. It works just like our own biohormone that communicates with the receptor 100%.
So tell us really briefly, because you're talking bioidentical hormones right now.
Yes.
How is that different from pharmaceutical hormones?
Well, that's a huge, big difference. And that is the part that is very important about this conversation. And most people don't understand it because they think, oh, a pharmaceutical company is making it. They are billions and billions of dollars, and the doctor is giving it to me, and he is licensed and he looks after me. So it should be all very good. However, the funny part about it is that the supplemental biohormones that are natural and bioidentical is identical to the ones that are in your body. However, the pharmaceutical hormones are not 100% identical. In fact, they are only approximately 80 to 90% identical. So therefore, there are many problems that occurs when you use pharmaceutical different hormones because they don't fit the receptor perfectly like the one that your body does, and therefore leaves and created all of this problem. This is a huge, big problem because we have all sorts of negative side effects that are actually causing more problem than they are helping you. So be aware that the supplemental bioidentical hormones are perfectly identical to your own hormones that God gave you, but the pharmaceutical hormones are not identical, and therefore it opened up to all these possibilities of side effects and very, very negative problems.
So that's actually our main topic of today. You know, when you go to your doctor and you're saying, I'm feeling really tired, I'm not normal, I can't sleep, I can't, so I'm starting to age. And your doctor introduces the idea of hormone therapy, right? Replacement hormone therapy. So what kind of tests are they going to run? And what is that all about? I mean, why would you go for hormone therapy?
Well, obviously, you were at your best when you had plenty of biohormones in your body. You were, like I said, full of energy. You look wonderful. Your skin was beautiful. Your hair was abundant. You were absolutely at your best. And if you wanted to lose weight, all you had to do was skip lunch. My goodness, you lose 10 pounds skipping just one dinner, and you are back into your wedding dress. You're back into your high school prom dress. So this is really wonderful. But however, when you start to lose these biohormones, and as you age, you are not getting any more what you used to get. So therefore, all the work, all the beauty, all the health, all the immunity that your body had, you lost some of it. And so they lose energy, they lose brain, they have brain fog. So what do? The doctor says, let me help you by giving you some supplement, some way to help to balance that deficiency. And we can do that, and we'll talk a little bit later about the testing. But I want you to know that we need that extra supplementation because we don't want to be low on our biohormone. It's kind of having low oil in your engine because I tell you what, if you don't have oil in your engine, you keep driving it, you are going to burn that engine. And same thing with your body. If you don't have biohormone to help you to keep healthy, to keep beautiful, to keep useful, then what happened? We have all sorts of very, very bad diseases in your heart, in your brain, in cancer, all sorts of other problems. So the most important thing I wanted to share with you is that the pharmaceutical biohormones are very different because the natural supplement of the hormones come from, of all things, a plant potato. That's right. It's a potato. They extract the potato and they make our natural biohormone that is identical to your body, identical, no difference whatsoever. So it acts the same identical way. But the pharmaceutical biohormones are not made the same. They are made from coal tar. Coal, a chunk of black coal. They extract the tar out of that. They also will often use a horse. That's right. They will take a mare, a female horse, they get her pregnant, and then they will make her urinate so that you can take the urine from a pregnant horse and they make the pharmaceuticals hormone from those things. And I tell you, with organic uh, uh, solvents, with many different kinds of antifreeze, they are made from all of those toxic, very different than our human body. Because you see, a horse's urine, the hormones are nearly 200 times more powerful than the human hormones. So it doesn't compete. It's not compatible. It's not working exactly the same and creating big problem. So I really would rather offer to our patients using only potato plant-based supplements.
Wow, that's interesting. Obviously, that doesn't seem very compatible to our body coming from a horse's urine. Can you kind of list some of the side effects that
Oh
would?
my gosh, yeah, Charn. This is a real problem because you know what? All the doctors know about it. I'm telling you, because many years ago in 2002, the official journal of the American Medical Association, did a vast, one of the biggest research worldwide with thousands of women, and they used double blind so that the doctors didn't know what they were taking, giving, and the patients didn't know what they were taking, and they wanted to see how does these pharmaceutical hormones work in the human body. And I tell you, lo and behold, they had to cut the research early, cut it off early. Why? Because we found that a very dangerous, large contingency of women, in fact, it was over 26% of all the women that was in this study, started to go towards having breast cancer. I am telling you, that scared everybody because it was not a small little thing. It is epithelial breast cancer, which I tell you creates horrible problem. Of course, we see in our practice, we see patients coming in with swelling, with problems with joint pains, with gaining tremendous amount of weight, with having no problem before with their brain. Now they cannot think, they cannot remember, they got brain fog. I am telling you, we have problems with these pharmaceutical hormones, but the worst was the research published by JAMA creating potential side effects of breast cancer. And I
Is this
stay
research
away from
public?
those. I'm
Is this
sorry.
research public? I mean, can anybody look it up?
Public. One can actually see it. You can Google the research for JAMA on 2002 on on the hormones that the Premarin, that the hormones that the pharmaceuticals are using, and you can read it for yourself. All doctors know about it, and if you don't know about it, then you are not doing your job.
Can you tell us a little bit more about that biohormones? What's the best way to take it?
Oh, I am telling you, this is a very important piece of information for all of you. And I tell you, I see this a big problem all the time. We see it in our patients. Our patients come in. This lady, Sandra, came in with taking all of these pharmaceutical by mouth. She was taking tablets, and the doctor gave her tablets to take progesterone tablet, 200 milligrams, way more than what she really needed. And then she would do surgery and give her pellets in the butt on testosterone. And then she would give her all sorts of patches. And I am telling you, they are all over the map. And those are very dangerous. You know why? I explain to you. The reason is because when you put a hormone as a capsule, as a pill in your mouth, it must, because science works that way. Our human body works this way. It must go through something. And it goes through what? It goes through the stomach where it's digested, and then it will go to the liver. The very first stop of every food, of everything we put in our mouth, must pass the liver. Why? Because the liver is the filter of our body. It's the one that actually monitors carefully what goes into the blood. And because when you take 200 milligram of progesterone or testosterone or whatever, and that is way too much, maybe 100 times more than what our body could use, then what is the job of the liver? The job of the liver is to do what? Is to make sure that you cut it down and that you only allow the certain tiny amount of that progesterone to go into the blood. You don't want too much, because if it's too much, you're going to die. You're going to have problems. So what they do is they create a toxicity to the liver. The liver becomes toxic because it is overwhelmed with all of this pharmaceutical hormones that she cannot let go. So the liver create a substance called sex hormone binding globulin. Sex hormone binding globulin, SHBG. SHBG. You can look it up. But SHBG basically is the way of the liver to take down 99.9999% of all the progesterone, all the hormone that you put in your mouth go into the liver. So we don't do that anymore. It creates way too much trouble. It creates side effects. It causes big problem for all the hormones in your body, because SHBG will literally lower the level of all your hormones, not just the progesterone, but all of them. So what is the best way? And what we have found and what the research have shown, the best is to use a cream. Oh, my goodness. It is so simple. You put the cream on the skin, And little by little, through the whole entire day, tiny little bit goes directly into your lymphatic system, into your bypassing the liver without creating the toxicity, without creating SHBG, without creating all the side effects that happens when you put these terrible things in your mouth, in the surgery where it can become infected, all sorts of very painful projects that the doctor will use, and I don't think they are good for you. So we stick with the cream, and the cream is the way to approach. It's called bypassing the liver.
So is this cream available through Barm to both men and women? Obviously, there's different different products, right? Can you?
It you know this problem of the hormone losing when we get older, it affects everybody. It affects men, it affects women, because men has biohormone with the testosterone, with the DHEA. Women has testosterone, DHEA. We have the same biohormones. And however, we use many different kinds of balances, because many times, I will tell you what is very important, and we'll talk about that in the next question, is that when we do the testing for our female patients and our male patients, we are looking for the toxic, it's a funny hormone that is made from 3 different estrogens, very toxic. It's called estrone. Estrone. And the reason that that's very toxic is because in females, when you have this bad estrogen, my goodness, it creates all the problems with cancer of the breast, with cancer of the ovaries, with uterine cancer, with cancers from many different parts. And the male, for the man, it creates cancer of the prostate. So this change of bad estrogen is very important for you to actually know by your test where and how much exposure you have onto those cancers. So this is very important for everyone to protect themselves, because most of those cancers are preventable and we can do it. And men, we use the same, but we use it same biohormone, but we use a little bit higher because men needs more testosterone than women.
That's right. So let's get into testing. Let's talk about that, because I know traditionally, your regular doctor would just give you a blood test, right? And tell us the difference between a blood test and the ones that you offer at Barm, and what does that measure?
Well, the really exciting part is that we don't want to hurt you. So we use a non-invasive testing. All you have to do, this is a wonderful, accurate test. All you have to do is spit. That is it. So it is easy. It is not painful. You don't have to get nervous. And we can measure all your biohormones from your spit. So what is the difference between blood testing and salivary testing? Blood testing, I will tell you, is a good test, but it requires you to go to a laboratory where they stick a needle in, and all of that creates a immediate stress in your body that will overflow a lot of this biohormone, so that the test result that you're getting is not accurate. Why? Because you're under so much stress. Can you imagine when I go to a laboratory, and I'm a doctor and I do blood testing for everybody and did millions of them, and I tell you what, even I get anxious when I see this big lady coming over with this big needle and is going to stick it up in my arm. And I tell you, I worry always that they're going to miss the vein, and then they can keep sticking me 4 or 5 times, and it's very painful. And I tell you, I get stressed out. when you are stressed out, all your hormones are going to go all over the place. They become highly evolved, so that the testing itself is potentially inaccurate. But the biggest problem is that 90%, and you can Google this, 90% of all the hormones that are running around in our blood, where they are going to take the sample, 90% plus are already used up hormone. These are no use hormone. They're kind of like used up batteries that you put it back in the box with all the good batteries. Now you don't know which one is good and which one is not good. So when you do the blood test, you are measuring the amount of hormone that are already used. And that is no use to us because, discharged used batteries are no use to anybody. We need only clean new batteries that we can use, put it in our toy and make it go. So the saliva, the beauty of the saliva is that it only measures the hormones that are available for you to use. That's it. It is so good because it already knows that your hormones are available to you. And you will know if it's deficient and you will know if it is out of balance. So salivary testing, you spit 5 times and different hours of the day, because we are measuring different ways of our body makes hormones at different times. So these are all very important, and they are done with just a simple spit.
That's very interesting because a blood test actually only measures a moment in time, right?
That's only 1 second where the salivary, it's a very good point, Charn, and I love it. It's with the salivary, you're testing throughout the whole entire day, all the way from the early morning to late in the evening.
So it's more accurate, I would
more
say.
Accurate and more specific.
It's interesting that you had mentioned about blood tests and raising stress. I actually have a sister, and she went in to get her blood test, and they had tried multiple times, 3 times. They couldn't find her vein, and she had to come back the next day, and her arm was all bruised up, and they had to try. And so I was like thinking, oh my goodness, it is true that you go through a lot of stress when you take a blood test, and that can affect the results for sure.
I am just a real fearful. I tell you, I am no good at pain. I tell you, I am allergic to pain. And whenever they stick that needle in me, my anxiety goes way out, and I am in extreme stress because I am such a really horrible allergy to pain of any kind. I'm telling you.
Okay. Well, let's get into some of the products that are available, biohormones available through BARM, because now that we've taken the test and you're going to get results coming back from BARM, right? What are these results going to tell you? How do you go through the process of having, a report, a consultation, a recommendation?
Very good, because that is the beginning. When you run the salivary test, it comes in the report and it tells you each of the biohormones. And there are 8 biohormones that we are doing, and each one of them we see if they are deficient. Because if they're deficient, then we need to help to put some supplement, some cream on the skin to schedule the hormone to be at a higher level so that you can have the help that your body needs in order to be healthy. So this is really key. When it comes back, we will study it, and the interpretation is the key. Most people don't know how to read the salivary report. They don't have the experience because they don't do it for a very long time, and they don't study it as well. We do this constantly. And the most important part is that we have written several books on just the salivary. We have written texts, we have written big papers on salivary so that we know a lot about it. And what we do is we have an experience on what to look for, how to balance, and what is the best way to protect you from potential cancers in the future. So the real key here is that we send you a written report. It will be typed, it will explain each one of the biohormones. What does it mean? What is the problem? And how do you take care of it? And I give you a very specific protocol, the treatment plan, using only the supplements from the plants. And you can then follow that. And then we call you, or you can actually make an appointment. It's free. Make an appointment with me, and I will explain to you step by step how to get your body back to being young again, to being strong again, to being beautiful again. And yes, you're going to live much longer.
What's very impressive is that not only are you helping, patients, but you're helping doctors to help their patients. So doctors are, seeing you at speaker events and industry events. Medical associations are coming after you and asking you for assistance and talking about this very important topic. So, not only are, the laymen coming to you, but the doctors are trusting, your advice, your research. And now let's talk about the products. So they're available through BARM, through Health Secrets USA. Tell us about the different ones that can help both male and female.
Well, to begin with, for the female, it's very, very cool because we can balance your progesterone. It's a cream. All you have to do is put 3 or 4 pumps at night, and you put it all. Rub it vigorously on your skin until the skin absorbs the cream, and you are now protected all night with the better level of progesterone. But we also will protect you from the bad estrogen, because there are 3 different kinds of estrogens, and some of these 3, one of them called estrone, is a problem that creates potential cancer risk. We will give you supplements that will actually protect that, will actually create the ability to stop that estrone from actually getting overbearing and utilizing your whole body to create problems for you. So this is the second step. The third step is really balancing the hormone. You remember, it is a matter of a balance. The proper balance gives you the best health. So too much of something is not good. Too little is not good. The best in terms of all of our health is always medium in between balance. And for men, we have actually the DH, and for women, we actually have a DHEA, which is a hormone for the young people. We try to actually make you younger, because that is why using the good hormone, biohormone, actually make your skin more beautiful, less wrinkles, better quality, the hair growing. A lot of older people lose all of their hair. They are going bald. And I'm telling you, it is painful to see. Because when you start to lose all your hair, you don't look very good anymore. And I tell you, it is very important to give that biohormone the ability to give you the skin. And when you look at it and you see how it made your skin glow, how it helped you to wipe out the wrinkles, well, you think this is a sign that your lungs are getting better, your liver is getting less wrinkles, you are getting good health in all the tissues in your body. So it is very important that we use the cream and we use different plant-based supplements in order to balance your biohormones in the body as a result of the testing that we have done with the saliva.
That's great. I can actually attest to that. I had my husband on many of your supplements. He did the consultation, he did the saliva test. He has been taking it for almost a year now, and he's kept 20 pounds off. People looking back at his pictures from when he was 58 to now, he just celebrated his 70th birthday, and he looks much younger. He's lost all the weight. His hair looks amazing, his skin. And if you saw the before and after picture, you'd be in shock. I mean, the picture tells everything. So
Yeah.
I was super happy. Now, do we have to wait until we're a certain age or when we start feeling sluggish to start taking these biohormones and start taking care of our body? Or what age do you recommend that we start taking care of ourselves for the saliva test and think about this topic?
Well, obviously, if you're having problems
Right.
and your biohormones can go down even though you're only 25. And how does that happen? Well, if you just got fired from your job and you're depressed and you're not eating well and you are having all sorts of anxiety, you're not sleeping well, let me tell you something. Your biohormones are going down south. Your biohormones are going to leave you and you are going to feel terrible. So obviously, when you are feeling well, obviously, if you have signs and symptoms of aging, such as getting tired, such as having brain fog, such as having problem with your urination, such as having problem with your sleep, such as having problem with gaining weight, all of this is a sign that there is some problem with your biohormone. So when you see problems like that, oh, of course, call us. I will run a test. I will teach you how you can balance it. But the real key here is that when you get to be around 45 to 50, you are what we call perimenopause. What is perimenopause? The word peri means around. So perimenopause is when you are getting close to be around your menopause, when you lose 80% of all your biohormone, lose 90% of all your biohormone. My goodness, you are in deep trouble because basically when you're going through menopause, it changes everything. You got hot flash, you got night sweats, you got depression, you got brain fog, you gain tremendous amount of weight, you have all sorts of wrinkles, your hair falling off, you are having all sorts of problems with your urination, all sorts of problems with bladder infection, all sorts of problems with your sexuality. This is not a small thing. It's a huge, huge problem. And we know how to fix it. So the earlier you come in around the perimenopause, somewhere between 45 and 50, I can start to help you to prevent any of the problem. Because when you wait until you have a flat tire, it is not the smartest thing to do. It is much better if you change your tire before you have a flat tire. I tell you that it is so much easier for me to help you when you come earlier. And principally, when you are going through menopause, when you're going through andropause, when you're starting to see those signs and symptoms, let me tell you, this is a really big shout out to you to go to see your doctor and get a saliva test and get some of these natural plant-based biohormones, and you will go back to being young again, to being healthy again, to being beautiful again.
So is that your secret? Because you're what, 76? It's
Yes,
amazing how much energy you have.
yes,
Uh,
yes.
I saw you on stage and I'm like, wow, that guy is, definitely a prime example of, anti-aging because, I see people aging around me and they're starting to lose their hair, definitely brain fog and
Yep.
chronic stress. um, starting at a very early age. I mean, I'm surprised that some people in their late 30s, or mid 30s are not remembering, and our indoor generation being on the computer, not getting the vitamin D that you always propose that it's very important for immunity. I mean,
Yep.
we've got to take better care of our health because it's number one, right?
Our society today is full of anxiety, full of stress, and there is nothing worse than chronic stress because it throws our whole body off and we start to have all sorts of anxieties. We start to have all sorts of depression. You have no idea. Depression is a huge, big problem with a lot of people, and these are unbalanced biohormones that we can help you to put it back. We can help you to actually get healthy again. You're absolutely correct.
Yeah, well, thank you very much, Dr. Tai. We are always trying to bring very important topics to the forefront. Dr. Tai, we're so happy to have you here today. Please, everyone, take advantage of this opportunity to connect with Dr. Tai. He is available for consultations, free consultations. You just need to book it via the link, and you'll be able to, take the saliva test, get the report, follow up, and get started on your health now because you don't want to wait until it's you got that flat tire, right?
That's
Well,
right.
thank you, Dr. Tai. I appreciate it, and we'll tune in next time. Have a nice day, everyone. Take care.
Thank you so much for having me. Bye bye.